Hi, everybody. This is Raj Mago. I'm here with Dr. Elna Yadin, PhD, who is a leading expert on behavior therapy of OCD. Thank you, Dr. Yadin, for speaking to us today.
My pleasure.
Can we please start? Can you tell us a little bit about your background and your work in OCD?
Yes. So I actually began my training in neuroscience before it was called neuroscience, and I was interested in mechanisms of relief from anxiety in the
Yeah,
brain. And one of my tasks was to come up with an animal model for obsessive compulsive disorder in the early 90s.
I see.
The mid 80s, early 90s, and in researching how to represent OCD as an animal model, you really have to learn a lot about the condition.
Yeah,
And so I did a lot of reading at the time and found out that actually this is what I trained all my life for. The the marriage between neuroscience and how understanding the brain helps us inform clinical practice, at which time I did a pretty quick respecialization training
I see.
with some learning at Beck Clinic and with Edna Foa. And
Edna Poa is one of the world's leaders in behavior therapy of OCD,
OCD
professor
and PTSD,
and
especially
PTSD
now.
also.
Yes,
Yeah, yeah,
exactly.
and is a professor at the University of Pennsylvania. She was my teacher when I was a resident there.
Exactly. So what I ended up doing is becoming, so spending most of my time working on anxiety disorders, but focusing on the OCD, which seemed to be a very neurologically, genetically hereditary condition
Absolutely.
with some psychological and environmental input into it, and so it fit my qualifications and my temperament in that way. And
So you
so
moved from neuroscience to clinical psychology.
right, exactly. And with the clinical psychology, with some research in clinical trials and things like that, and being an independent evaluator for some of the studies that were run at the center. But I ended up joining Dr. Foa's clinic as the head of the OCD clinic there, and did that for 18 years.
Right. So you were director of the OCD clinic at the University of Pennsylvania for 18 years. Wow. Okay.
Yes.
And then, and what about, and now you are still very
Right.
active
So,
clinically, right?
right.
You still
So
treat a
when
lot of patients.
Right. So when it sort of seemed clear that we need to promote some younger faculty members, it was the right time to for me to kind of let somebody else do that work, which they're doing beautifully still today.
Yeah.
And the clinic is thriving, and so I was able to step out and be just sort of spend my time in a private practice, and I'm spending a lot of time now disseminating the treatment pretty much nationally and internationally. So that's kind of and advocating for OCD clients.
Very nice. So where is your private practice based?
So
In
my
Bryn
private
Mawr,
practice is based in Bryn Mawr, the town of Bryn Mawr,
in Pennsylvania.
in Pennsylvania. Exactly.
Right. So you are personally treating patients, right? You're not just educating people, but you personally are doing behavior therapy. So you are
I
at the front lines.
I'm on the front end, and I feel that because there's not that many experts in the field at the moment, we want to both train people, but we also want to be offering treatment for people who are seeking it.
That is absolutely the best. Like I myself will never, I see patients directly, like without any residence or anything, because I am a big believer in this idea that there are many people who are famous educators, but they don't actually treat patients.
Yes,
And
exactly.
we need educators who know the problems because they're not just lecturing about it, but they are treating patients. So that is great.
And also, you just want to know what's happening to patients these days. There's changes in their lives, there's social media, there's a lot of things that impinge on their and
Right.
can feed into their OCD. It's really good to be part of that. And I work with all ages. So I work with children, adolescents, which are actually the best time to treat OCD, and young adults, and then, of course, anyone else at any age who's still struggling.
Right. And you have written, I think, at least two books about OCD. I myself read and used your the book. One of them, you are the first author, which is the treatments that work, treating your OCD with exposure and response or ritual prevention workbook. You are the first author. Yadin, Foa, and Lickner. And then the other is the therapist guide. They are sort of supposed to be used in, I guess on the screen they may be seeing it backwards. I'm not sure.
No, they seem good. They seem
You
well.
know,
Yeah. So
okay,
one
so
of
it
them
is.
is a therapist guide. It's a treatment that work series. There's a treatment that works on almost any condition, which is
Yeah, this is a
wonderful.
fantastic series. Yeah, highly
And
recommended.
they're,
Yeah.
and they're sort of companions. One is for the client if you want to. Many of these things are downloadable. So, if somebody wants to just buy one of them, the therapist guide is the best one to get.
Right. Okay. That's the one I also recommend. It's great to be able to talk to the author directly and ask questions.
One, one,
So,
one of the authors.
but yeah, one of the authors.